your due date for 11.
What?
How many times have you been pregnant?
3.
This is your third pregnancy?
Yes!
You have 2 babies
It's
at
in
home?
my ass!
You have 2 babies at home? Who's your doctor?
Lang is her doctor. Y'all treat all your patients like this or just the black ones?
Beverly, this is the first another patient for you. Alright, last name is Jones. She's G3P2. I'm not sure when her due date is.
Her due
I
date is
just
the
said it
10th.
was the 10th.
I think her due date is the 10th.
So this is what we call medical racism, huh? I know racism is bad, but this is a different definition of racism. Medical racism. But like a woman in labor?
She had 3 pregnancies, 2 babies at home.
To
I bet y'all listen next time. When you found out you was delivering at this hospital, your ass should have changed doctors.
Thank you.
Everybody say how they treat people here.
This video is one of those that you watch and you get out of words. For what? Why? Man, I don't know what kind of hatred you could be having towards black people that you would leave a mother in such a situation.
Now.
You have 2 babies at home? Who's your doctor?
Lang is her doctor.
Let's talk about this Dallas video because it's not just bad behavior, it's dangerous, it's discriminatory, and it's why black women in this country keep dying. The young woman's in active labor, and clinically we all know that priorities shift. Intake stops, and your eyes should be on that mom and the baby. But instead, we're watching a nurse sit there asking frivolous questions while a black woman is clearly in distress, progressing, and not treated with the urgency and dignity that she deserves. It's not just rude, it's dangerous. It's egregious, and it's actually disgusting medical care. And I need y'all to understand something, that as a black OBGYN, this is not an isolated incident. This is a culture. And this is what happens when a healthcare system that is not designed for anyone outside the majority, this is how it affects and shapes the legacy and how black women are treated in real time. This is our maternal mortality numbers. This is how black women end up ignored, undiagnosed, untreated, and unprotected. It's a bias, it's systematic, and it's behavior like this that gets passed down, normalized, excused. This is a culture problem in Dallas, Texas probably as a whole. And a culture doesn't change with a press release. It changes with accountability, retraining, leadership, consequences, and a refusal to let people like this touch patients. So, in closing, black women deserve urgency, compassion, and clinical excellence. This ain't it. What we saw was unacceptable, and it's time that the healthcare system finally stops pretending that this doesn't happen.
What exactly did you catch when you were watching that viral video of a woman 12 minutes out from giving birth dealing with this redheaded nurse? Did it remind you of your mother-in-law? Did it remind you about being a fancy black person, maybe shopping for something, having an accent in the wrong place? Do you think you can spot when someone checks their social status against yours? Let's process it and the feeling of powerlessness and anger that you had watching that video together. So the now infamous Dallas Regional Medical Center, a young black woman has come in because she is about to give birth. She's actively in labor. The nurse knows this. The universal medical standard of care is that this woman would have been rushed to labor and delivery where she could be monitored. Whatever extra details that they needed to get could have been taken from the person who was accompanying her along the way. And this mother in particular had apparently already sent her information ahead. She had established care at this hospital. Here she is, wailing in pain, going nowhere as the nurse stalls. There was zero sense of urgency, and there was absolutely no patient assurance. The nurse keeps mother and baby in the intake room. Now, we could say nurses are used to pain. They've seen hundreds of births. They're not going to freak out, as one might say. But we're not talking about freaking out here. We're talking about someone who knows that the person in front of them has not lived through hundreds of births and who is in pain and in need of medical attention. The nurse is very aware that this woman is frightened and in pain and is about to do one of the hardest things any human being can ever do. And she shows, literally no exaggeration, you could go watch the video, zero empathy or concern or any reaction to the Black lady's pain. And what this medical professional is aware of with every minute that she waits is that she's putting the mother and baby at risk of something being missed. She's keeping this woman from the chance to be monitored. She is slowing down and preventing the process for any pain relief or oversight to get in place. If there's an emergency happening, which she can't know in the intake room because, again, no one is monitoring her, these couple of seconds or minutes can be the difference between life or death for the mother and child. On top of the unnecessary delay, the lack of connection and concern being shown here is absolutely adding to the patient's stress, which is also stressing the baby that's about to be born. That stress on a person's nervous system has a weathering effect that can make them more likely to die. The family has reported back that the baby did have complications during and after the birth. The nurse failed to do her job, and she did it in the grand tradition of nurses using their position of power to status check people. This is one more link in the long chain of maternal health crises for Black and Indigenous women in America, not because of their class, not because of other comorbidities, not because of issues they've had with childbirth before, but because of medical negligence and racism. Lack of response is a form of weaponized negligence that looks at a Black woman and goes, she can take it, she's tough. We could also say we saw here malicious compliance, where somebody uses the cover of the process to delay having to service or care for you. They're policing you or punishing you for daring to even come here and ask for services and resources in the first place. People walk around with this idea of who they are and what their space looks like. And when you come into their space as a Black person or a fancy Black person or somebody who needs them to take care of them, there's a level of thinking that I'm too good to be taking care of this person. I am too good in this situation, this store, this shoe, this bag, whatever it is. It's too good for the people who are asking for these services. So I'm going to make it expensive for them to be here. So they use their jobs to covertly assert dominance.
I want to give an update to this story out of Texas of the woman who was giving birth and seemingly being ignored by the nurse there entering the information. And we've got some more video, actually. I'll show you that in a second. According to the mother of the woman, she was supposed to be induced that day. And so they called that morning and they didn't have a bed. So they told her, hey, we'll call you when we have a bed. Well, apparently that never happened. And then her water broke. And so they call and say, hey, my water broke. We need to get in there now. So they head up to the hospital. When they arrive at the hospital, they arrive at the ER section of the hospital, apparently. And the nurses there said, no, you can't come here. This is only for ambulances. So they made her go around the front. The mother comes in to say, hey, my daughter's in labor. We need to get her in now. She's in the car. And apparently nobody helped her. The mother alleges that she was told to go get her own wheelchair. Yes. And the only person to help them was the officer who was in the ER. The only person to go out and get the woman out of the car was the officer. Now, keep in mind, they were expecting this woman. She was scheduled to be induced. So they should have already had all this information. They should have already known all that. It doesn't matter, because a lot of you are messaging me saying this nurse was only doing her job. I do not care. At some point, we got to have some sort of common sense. And speaking of that nurse, there's another video of a separate situation. Watch her attitude in this video.
Going back in the building, man. We got it.
I'm going to wait right here with my boyfriend.
All right.
You can go ahead and turn your phone off too, please.
I can record. I'm in a public place.
Recording everything that you're doing, so.
That's fine. That's fine. All right.
Yeah, look at the treatment.
This is a failure on all levels. I get the nurse was probably doing her job. The attitude was poor. I understand, y'all. I get what you're trying to say. The system's broken. It's not necessarily her. But I don't care. She is a nurse. She is a nurse. It was obvious that woman needed medical attention immediately. If she would have rolled in on a ambulance, on a gurney, y'all wouldn't have done that. Y'all don't do it for people unconscious. Y'all don't do it for people who needs a doctor rolling in on an ambulance. So why are we doing it to this woman?
As someone who's about to give birth, watching that video of the woman at the Dallas Regional Medical Hospital was absolutely traumatizing, to say the least. But honestly, it did teach me this one thing. It reminded me the importance of praying over the staff for those who will be on shift when I deliver. When I tell you I will be praying in advance from now that the Lord God will orchestrate the right people to be on schedule, from the receptionist to the clerk to the day shift nurse, the night shift nurse, everybody. Because no pregnant woman in her most vulnerable stage should have to go through something like that. The woman literally didn't even look her way. There was no empathy, no care at all. That was just pure disgusting. That was racism. And I really hope that the hospital took extreme measures and let her go. And even took her license, because honestly, if you conduct yourself like that, you do not need to be a nurse. Sorry, someone was at the door. But honestly, yeah, if that's how you conduct yourself as a nurse, you do not deserve the title as a nurse. So again, if you're a pregnant or expecting mama, or you know someone who's pregnant and expecting, make sure that you say a prayer for them and remind them to say a prayer to the Most High God to put the right people in their path when they give birth.
I just watched one of the most profoundly racist videos that I think we will ever see. What I'm describing to you is a video that I just came across in Dallas, Texas, where a mother came home to find her daughter in active labor, having active contractions. Rightfully, what does a mother do? She calls the hospital ahead of time, tells them that they are coming to the hospital because her daughter is in labor. She is screaming. You can hear her. Active labor. They take her to the hospital. They pull up to the emergency room. All the nurses, they all come out running, have their gloves on. But as soon as they look at them, obviously realize they were a color of kin, they literally said, "This is only for ambulances." Then the mom's explaining, "My daughter is in labor. She's having active contractions. She's screaming. You can hear her." Still, this is for ambulances. You have to go around front. So she has to drive around front. And at that point, her daughter is already having active contractions. It's even worse than it was when she was at her house. So she pulls around front. She runs inside and tells them, "My daughter is having an emergency. She's in active labor. She's having contractions," re-explaining the story. What does the nurse with the red hair do? Wants her to fill out all this type of paperwork, asking all this type of information while her daughter is having active labor. And she's just blatantly not giving two craps. The mom asks, "Okay, so where is your wheelchair so I can at least get her in here?" She says, "Oh, it's around front, around the vending machines." Doesn't care. Doesn't offer any help. Doesn't send the doctors or nurses out to grab this lady to bring her in, making the mom do it. Okay, so the mom goes and gets the wheelchair, brings her in. She's screaming, having active contractions. Hello, she's in labor. She is screaming. Bloody murder. They don't do nothing. They don't care. They just bring out a stack of papers and they want her to sign this paperwork before they even set her up with anybody. Over half an hour they were waiting. Even while so, the nurse tells them to move out of the way so they can help other patients that are coming. They want them to move out of the way while her daughter's in active labor screaming. Move out of the way. Okay? Follow me. Follow with me. Now, during this 30 minutes, that's where the mom catches everything on video, where the nurse is actively not caring while the daughter is sitting in the chair screaming, and then standing up and then bending over in their chair screaming in pain for over 30 minutes while the nurse is just sitting there asking all these questions. What's your name? Blah, blah, blah. All stupid shit. Just get her to a room. She's still in the waiting room. Over 30 minutes. They didn't give two craps. This happened at the Dallas Regional Medical Hospital. Literally. And it was posted by Sugar Babies if you guys want to go see. And it's in my repost as well. But this is the Karen with the red hair. This is her. All while the daughter even asks her, could you please call the anesthesiologist, something? And she tells her, sorry, I can't help. Actually, she doesn't even say sorry. She just says, I can't help you. This is the account, Cashman2814. Go follow so you can see the video that I'm talking about. But there's multiple videos explaining what is happening. It's blatant racism right in front of our face. And they do not care.
This is a really hard watch, but we need to talk about it.
11.
What?
How many times have you been pregnant?
Now, I'm not an obstetrician, I'm an emergency physician, but up until recently I worked in a dedicated women's emergency department. So I saw many times women would come through the emergency department in active labour. And to think that that kind of behaviour happens in some hospitals, it is truly heartbreaking.
This is your third pregnancy?
Yes!
You have 2 babies?
It's in my ass!
To watch a woman who is clearly contracting, she is clearly in a significant amount of pain and clearly telling the staff, my baby is coming, and to have her repeatedly questioned instead of being immediately assessed and even comforted, it is not acceptable. It's actually distressing, and this should not be happening anywhere. This is not about blaming one individual person. This is about acknowledging that systemic issues exist, including racial bias, communication failures, and times where protocols and paperwork seem to take priority over the patient that is right in front of us. In healthcare, we are taught to listen to our patients, especially in women's health and obstetrics, where lived experience and maternal instincts is incredibly accurate. If a woman says the baby is coming, that's an emergency. Full stop. And always get the history and do paperwork after the person is safe. Seriously, this has to be a reminder to all of us to slow down. Listen to the person in front of us. We should be asking ourselves, what is the immediate clinical priority? Am I truly listening to the patient? And are any of my internal biases swaying my perception? We can do better. We must do better, especially for Black women who statistically experience higher rates of maternal morbidity and mortality. Listening saves lives. Believing women saves lives. And responding quickly saves lives. If you are a clinician, a nurse, a student, anyone working in healthcare, please let this be a moment of reflection. Compassion and clinical urgency is not optional, it's the job.